They say a moment on the lips, forever on your hips. Not anymore. With 4 easy 30-minute sessions of EMSCULPT NEO, you can build up to 25% more muscle and 30% less fat. Arms, thighs, booty, and tummy, just about anything you want to tighten up. EMSCULPT NEO's got your back and your front. Let's give your bod a whole new definition.
Hello, everyone. I am Dr. Yehudi Monreal. I'm a board-certified family medicine physician here in beautiful Paso, Texas. We are CARES Medical Clinic. We believe in partnering with our clients to be able to transform their lives and be able to create treatment plans that are unique to whatever health goals that they are, whatever health goals that you guys have, whether it's losing weight, whether it's helping with sexual wellness, your sex life, whether it's being able to treat symptoms like urinary incontinence, being able to treat erectile dysfunction, fine lines and wrinkles, whatever it is, to be able to make you feel good in your own skin and make you be the better version of yourself. And I'm so excited today to be able to talk about 2 new devices that we're going to be able to have at an offer at CARES Medical Clinic. 2 treatments and devices that I really think are a game changer when it comes to weight loss, the weight loss world, the sexual wellness world, just functional medicine in general. And I'm here with my friend here, Nicole. She works with BTL. She's a wealth of knowledge and just excited for her to tell you about these machines, these devices, the treatments, the research behind it, and just how we could use this to be able to better patients' lives here in El Paso. Thank you so much for being here and coming. And
Absolutely.
Tell us a little bit about yourself and we'll go from there.
Of course. Thank you for having me.
Yeah.
So my name is Nicole Sarabia. I am a area director for the practice development side of BTL Medical. BTL Medical is a physiotherapy cardiovascular company first and foremost. And we've brought our aesthetic and functional side here to the States. And so the devices that you're carrying are 2 most popular devices that we have. We have EMSCULPT NEO, which is a 3-in-1 body contouring treatment, very popular for fat reduction, muscle building, toning, skin tightening for anywhere from head to toe. Pretty much we can do the biceps, the triceps, the stomach, the glutes, our thighs, and our calves. And then our other treatment that you kind of talked about a little bit is our micellar treatment, and that's treating incontinence for both men and women, so the urge or the frequent urge to urinate, as well as sexual function benefits. So it pairs really well with the hormone therapy that you're already doing, the medical weight loss regimens that you have going on in the practice. I think they're really going to pair really well together.
Yeah, no, absolutely. I think we wanted to choose devices that helped kind of already, how would you say, just added to whatever we're already doing. I think in the weight loss world, one of our fears with using a lot of these peptides is the muscle loss that one can get. I know research has shown that up to 40% of your weight that you lose can be muscle mass. And
Absolutely.
So we absolutely don't want that. It can cause other health issues. And so how does EMSCULPT NEO help mitigate some of that? Well, how can we pair it with weight loss in patients to get better results?
So that's something that we hear a lot as a fear of starting a peptide or something like that, because we don't want the lean muscle mass to be lost, right? That's really important in a weight loss journey because the lean muscle mass is something that's directly correlated with our metabolic rate. And EMSCULPT NEO is one of the only devices in the industry that's not only going to tone the muscle, but is FDA cleared to cause muscle growth and increase muscle volume size as well. So it's using a technology called HIFIM. It's high intensity focused electromagnetic energy. Essentially, it's using a 2 Tesla magnet to cause a super maximal contraction of the muscle. Putting that into perspective, if we're doing a voluntary contraction, like if I'm in the gym doing bicep curls, I can really only engage a specific muscle group about 40% of its engagement rate. If you're an Olympic athlete or a professionally trained athlete, you're maybe going to get closer to a 50 or 60% muscle engagement. With this 2 Tesla magnet technology, we're able to bypass the nervous system and engage that muscle from anywhere between 98 to 100% contraction rate.
Oh, wow.
And with the NEO, we're doing that 20,000 times in just 1 treatment session.
So something we couldn't do at the gym. Even if
not.
we, even being an Olympic athlete, we wouldn't be able to get those kind of engagement being going to the gym.
Oh, no.
Yeah.
And something that we also talk about is even if you are an Olympic athlete, or even if you're going to the gym every single day, you never take a rest day, your body's still losing muscle mass. It's a process called sarcopenia, and it starts at the ripe age of 35. So once you hit 35, every year for the rest of our life, we're losing lean muscle mass. And it doesn't matter how much protein we eat or what supplements we take, there's nothing we can do about that. So with the use of EMSCULPT NEO, not only are we mitigating that muscle loss, but it's actually able to counteract and almost combat sarcopenia. And we do have published journals that are proving that we can fight sarcopenia by increasing the number of muscle fibers, not just enlarging the muscle fibers.
Yeah, so I think one of the things that helped us be able to choose what device in this field, because there's multiple devices out there, right, was the research, the backed research behind it. Being able to target visceral fat. I know that's huge for combating against any kind of cardiovascular risks that we might have, heart attacks, strokes, things like that. So being able to, in weight loss, yes, we want to look good, but at the same time be healthier, right? Be able to live longer and have a better quality life. And so in the research behind and looking at all these different devices, having something that's going to be able to target the visceral fat was something that I wanted to be able to provide for my patients. You know, a lot of our patients, they want to be able to just to lose weight, but I want patients to lose weight the right way. And as you said, we all, after the ripe age of 35, you know, start losing muscle mass whether we want to or not, right? And so even our weight loss patients, if you're not one of those, still being able to use this device to be stronger, be healthier, you know, prevent against some of those diabetes, you know, heart issues that we might have with just losing muscle mass. Osteoporosis, that's huge. Having muscle prevents against osteoporosis, things like that. And so I think for us, being able to choose BTL was because of the research behind it, was because you can be able to lose up to 30% of fat, subcutaneous fat, be able to gain up to 25% muscle mass, and you have study after study kind of showing this. And so yeah, no, I think it's great. And so I think something that we can be able to pair for our weight loss patients, but then also I think functionality. I think, you know, the patients are like, oh no, I don't, you know, I'm happy with the weight that I'm at. You know, maybe our menopausal patients or older patients, I know that there has been you know, testimonials that I've seen of patients who have had back issues, patients who have had, you know, our rehabilitation patients where they've been able to walk again after car accidents, you know, things like that, that it's not just aesthetically, but functionally that where you can be able to use these devices. So
that's really big too, kind of going back to where BTL kind of stemmed from. It's a physiotherapy and cardiovascular company first and foremost. So before any of our devices launch commercially or touch the floor, they've gone through 7 years of clinical research and development before being able to be at your med spa or your internal medicine office or your plastic surgeon office. And a lot of our devices are actually studied at the Mayo Clinic because there's not really any devices out there that can manipulate the muscle like these devices can. So just like you mentioned, like chronic pain, it's a big treatment with EMSCULPT NEO and EMSELA to treat back pain, to treat sciatica pain. If you have a knee injury, you can treat the hamstrings and the quad muscles to kind of increase blood circulation and help with faster recovery. There's lots of athletes out there who will use the treatments to help enhance their performance. I see it all the time back in Dallas where parents will choose to treat their kids before them going to like walk on to a college, junior college somewhere, or being redshirted. They can increase their vertical. They can throw farther. They can throw the football farther. Volleyball players can hit further or have a higher vertical. So it's really popular. Even like small packages for golf players, treating their abs and their glutes to kind of help with their swing. I know over here being in Texas, we don't have a lot of snow here, but we're really close to New Mexico and Colorado. And so there's 1 week out of the year where everyone tries to go skiing for the first time. No one's training those muscles. No one's ready for that. But whenever you are using something like this, it can kind of help mitigate injury or anything like that. A lot of women also with EMSELA and NEO will use these treatments postpartum because we go through a complete body shock with our pelvic floor, with our abdominal muscles completely separating, and we don't really have anything set in our medical regimen to kind of like treat those patients after we give birth, after we you carry a child for 9 months. And with these treatments, it's something that will kind of heal for you without having to go in and be very invasive or be surgical. This is something that you can do before you're having to make that that really big step or that jump into going under the needle, going under anesthesia, taking all that time off work. This is something that even my plastic surgeons that I'm working with, my orthopedic surgeons, they're almost sandwiching it. They're doing this before surgery and after surgery to help faster healing. Or if the surgery doesn't take the first time, they're like, okay, well, the surgery didn't take, so let's go ahead and treat the root cause and treat your muscle and see if we can heal you from the inside out.
Like make it stronger. So again, not something that you just aesthetically to make you have the six pack, like you said, the medical reasons behind this. You know, we have like you had mentioned, the pregnancy and diastasis. You know, a lot of us who have, or those who have been pregnant have gone through those things. You know, just focusing on women for a little bit, you know, in pregnancy and women's health, you have the diastasis, you have the urinary incontinence that happens. You know, I think we hear it very commonly where you kind of, when you laugh and then you pee a little, you know, lots of things that make us embarrassed to talk about, you know, but everybody is silently suffering from these things. You know, so this is something we can be able to use for that too, right? And then also the sexual wellness part, being able to help with increase your orgasms, be able to, for males and females, you had said, correct?
Absolutely. So males and females both. So for male patients, it's going to look like, again, it can help with urinary incontinence. Both men and women have pelvic floors, so we both suffer from incontinence. But on the sexual function side, men are going to have longer lasting erections. They'll get their morning erections back, right? They're going to have longer orgasms and more intense orgasms. It helps with erectile dysfunction. It helps prevent prolapse. For women, it's going to help with pain during intercourse, again, more intense orgasms, vaginal dryness, all these things that we don't talk about. It's very taboo, but 8 out of 10 women in the U.S., not 8 out of 10 women over the age of 50, just 8 out of 10 women in the U.S. are suffering from either urinary incontinence and or sexual dysfunction. So it's something that we need help with.
A lot of people deal with and don't want to be able to tell, or sometimes also don't know who to tell, right? You go to your primary care, or you say these things and maybe they might not have options for you to be able to treat that, or it might just be surgery. You know, they're like, oh well, or they might be like, well, this is kind of what happens when you age, like, you know, like this exactly is your new normal.
Someone tells like you confide in somebody, and that maybe that one person's like, oh, like that's just what it is now, that's just, you decided to have kids and that's just part of being a woman, that's just part of aging, and it doesn't have to be that way.
No, absolutely. We don't have to suffer in silence, right? Menopausal, perimenopausal, all of that. We have things now, and there's lots of research behind it. It's not just, you know, something that somebody created or some type of tablet or whatever. You know, it's a regimen that we can be able to now treat that has research backed up behind it. And I think that's really important when it comes to patients choosing what provider they decide to go to, is somebody who is educated in multiple things to be able to help you, you know, get better, feel better in your own skin. I think for me, you know, why I did, or why I'm doing what I'm doing, you know, I had a long weight loss journey. You know, I was 300 pounds at one point in high school, you know, and so I did all the wrong things, you know, and then figured out the right things in medical school. And so I think seeing something like this, you know, in losing the weight, yes, you do have skin laxity. You know, I wasn't able to work out, even though I worked out like crazy, you still had some skin laxity, you know, and there are things that one has to do to kind of help with that, and your self-confidence and all of these things with it. You know, you do all of these things to kind of make you feel good in your own skin, have that confidence, just be the person that you've always wanted to be. And so if we can be able to add these things to get you there sooner, to get you there in a safe way, with maybe not spending so much money on surgery, or there's people who absolutely don't ever want surgery, you know, and so being able to have an alternative for these patients, I think is great. What would you say has been some of the stories, like your favorite, you know, story of how this has transformed or changed people's lives?
So there's a few, and most of my stories that are going to be the most heartfelt to me are the ones that I remember are less of the cosmetic side. Because I mean, the cosmetics, like, they're there, right? Whether you get the treatment for one or the other, a side effect is you're going to be leaner, you're going to be toner, you're going to lose inches or off your waist, or you're going to gain inches on your glutes if you're looking to grow the muscle. We have like a non-invasive BBL package, but one for the EMSCULPT is mothers who have kids and they're like, well, I can't play with my kids anymore, I can't chase my kids, I can't have them at the trampoline park, or I can't jump with them because I'm always so nervous about this. Or I've heard stories of like, oh, I don't sleep through the night, I wake up 4 times in the middle of the night. or I don't drink water before bed.
Oh my
And
goodness,
I just go to bed thirsty because I'm scared, to have an accident in the middle of the night. And then 3 weeks go by and they come back and they're like, this has changed my life. Like, they're in tears, they're crying, they are so emotional because like you've given them their autonomy back. Like you've given them their life back, and it's just something that we don't think about, right? And from the EMSCULPT NEO side, there's a doctor over in Norman, Oklahoma. Her name's Dr. Gina Ressler, and she actually was a patient before she was a provider of EMSCULPT. So she suffered from a stroke, and she shares this story all the time. And it left her partially paralyzed, and she could barely walk. She probably wasn't going to walk much. She couldn't hold anything on her own. She just was very reliant on her husband and her friends and family. And she started seeing this provider, and they were treating her with EMSCULPT, and they just were treating part of I think it was her left side of the body. And all of a sudden she was standing on her own. She was walking without a crutch.
Oh my goodness.
And every time I see her, she's just getting better and better and better. And now she ended up buying a machine and is now treating patients on her own.
Oh
so
my goodness.
I saw her last year at one of our conferences where she likes to come and speak and share her story. And she was dancing. She was two-stepping in high heels. And she was having the time of her life. And then this year when I saw her, she was like, you might not have noticed last year, but people were carrying my plate. She's like, I was functioning and I was walking and I was wearing my high heels, but someone had to hold my food because I would shake too much. She's like, this year I'm holding my own plate.
Oh my
goodness. So just small stories like that where it's like something that we don't think about, but it's very impactful and it's very special to kind of be able to hold your own plate.
Whenever absolutely. Things we take for granted right? That we wouldn't think bother us because that's not our story. But to be able to see this and see that transfer, like it literally changes people's lives, right? And so not just aesthetically or cosmetically, but something that functionally just improves people, improves. It's
and I think that's what people are looking for now. People are looking for something. There's I think the industry has gotten further away from aesthetics and it's getting really into the wellness aspect of it. I'm seeing it. I saw it in Dallas first, and then it was in Austin, and now it's kind of rolling into the smaller towns I'm working in. And people are getting less filler. They're wanting less Botox. They want more facials. They want more collagen. They want more PRP, something that's more natural. And people really aren't wanting surgery. They don't want to look different. They want to look like themselves, but younger.
Better version. And
so in order to do that, these treatments are doing just that, right? They're giving you your natural muscle, right? It's not injecting you with anything. It's not cutting you. That radio frequency is stimulating collagen. It's increasing blood circulation. So it's truly just enhancing you. From the inside out.
I think after COVID, a lot of us were more health aware, right? And so trying to be able to do things and invest our money in things that are going to benefit our health and the longevity part of it, right? We want to, I think, death and health and those things really was flat in our face. And so we're like, okay, what can we do to improve our lives, to make us live longer, to make us healthier against things that might be coming up, and so preventing disease, I know that's huge too. Preventing diabetes, and I know a lot of our weight loss patients, yes, they might not be pre-diabetic or diabetic yet, but they know they need to be able to lose weight. They don't want to get there, and I think we do have an issue now with insurances paying for certain things. They want to get certain things covered. You might need to be diabetic. You might need to be a BMI. But I think there's so much we can do beforehand to prevent you from even getting there, and so things like this, I think, are good that we can be able to pair with patients who want to take control of their health, who want to be able to invest in things that are going to make them be able to be more functional, be able to, yes, look better, but to be able to live longer and be healthier overall. And I think, for us, being able to pair with a company that also believes in that and has research and that was really what motivated us to be able to provide this for our patients, just to make El Paso healthier. I think that being born and raised in El Paso, I want to be able to have El Paso people healthier, for their families, for themselves. And so I'm super excited to be able to offer this, and thank you.
Well, I think we gave them a lot of information about what the treatment is. But if I'm a patient out there and I'm watching this podcast and I'm interested in EMSCULPT NEO and or Emsella, what does that look like for me walking into Cares Medical? What can I expect in my first visit with you guys, or what that treatment looks like. Do I need to get time off of work? Do I need to get babysitters? Am I going to have downtime? What does that look like?
Yeah, no, as far as the treatment, I think, great question. When you come to Cares Medical, we do approach things in a comprehensive way. So we do want to be able to see what it is that is coming, why you're coming in for. Let's figure out what is it, whether it's labs that we need to do. We'll do symptom checklists, see what exactly are the things that you want to be able to work on. And then, so with that, we'd be able to have a consult, sit down, let's see what treatment options work best for you. After looking at labs, after looking at symptoms, after looking at everything that we want to be able to tackle. As far as getting some of these treatment options, again, we compare this with whether it's medication, whether it's hormone balancing, whatever it is, but as far as the treatments themselves, no downtime as far as, this is all non-invasive. They're 28 to 30 minute treatments that you do during your lunch hour. You can be able to come, you'd be able to do a treatment of the machine, the medical device, and you'd be able to sit down if it's the EMSCULPT, or be able to lay down, and whether we're treating your abdomen, treating your thighs, treating your arms, your glutes, a 30-minute procedure. Non-invasive, you'd be able to feel the device on you. It is a series of 4 to 6 treatments, sometimes 4 to 8, depending on the person, that we'd be able to create these packages for you to get your best results.
Nice. And then once I've done the treatment, should I expect anything afterwards? Should I expect to feel anything, or experience any pain or discomfort?
Yeah, no, as far as it should not, it won't be painful. It's something that, it's a different kind of feeling. I think, you felt it, and me, myself as well. And so it's not something that's painful. It's not something that's uncomfortable. It's a different kind of sensation. It is the high fem technology that you're using. So you're getting, this engagement of muscle. I think for me, I felt a little bit sore maybe the day after, but nothing to where when I go to the gym and do leg day where I can't walk the next day. Like, it's not like that. You're able to see the results. You're able to feel that it is working, get engagement of muscles. But, again, something you can do in your lunch hour, something you can be able to go back to work that same day, the next day, something that you can be able to do on a weekly basis for the 4 to 8 sessions that we do, as far as whatever your package is.
We love a fast, easy treatment. Something that we forgot to talk about is your body imaging device that you're using to kind of track results. I think that's amazing for patients to be able to not only, obviously you're going to feel the results and we're going to see them themselves, but to see it on a chart, a 3D analysis of what not only are the measurements of my body, but my lean muscle mass weight, my body mass index, my water intake, being able to see those numbers and watch them go up and down while I'm doing the treatments.
Absolutely. I think that is important. We want to be able to track data and points, right? So not just that we feel better, our clothes fit better, but for us to be able to actually see the percentage, the amount of muscle we're gaining, the amount of, fat decrease that we're having. I think having those numbers is another reason to why you can invest in this, right? To know that this isn't just some kind of voodoo medicine that we're doing. It's something that actually has results and something that you can track for yourself for your own body. And so I think that's very important as well. And so let's see what else.
I'm excited.
Yeah, no, me too. I think being able to offer this in El Paso for our patients, I'm just super excited to be able to do that and be able to pair with a company that, is as passionate about this as we are. So no, we're very excited. We are located on 3130 Lee Trevino. We're on the east side. If you're interested, if any of this resonates with you, whether it's wanting to improve your sexual health, whether it's wanting to lose weight, whether it's wanting to just be stronger, whatever your health goals are, we're here to be able to help you with that. And so, just give us a call, 915-300-0067. And again, I'm Dr. Yehudi Monreal at Cares Medical Clinic, wanting to be able to partner with patients to transform their lives and create tailored programs for whatever your health goals are. And so thank you so much, Nicole. We are just, like I said, so excited to be able to pair with a company that has our same vision, to be able to help the people of El Paso, and just super grateful. Thank you.
Of course, thank you. Can't wait to come back.
Yeah, absolutely. Yes. And so she will be back for sure. We will definitely have some good before and afters, to be able to share with everybody and share their stories and all of that. So definitely excited. Yes, thank you.
Thank you.